You're doing everything right for blood pressure, diet, exercise, even medications, and it still stays high. That's because most plans completely ignore one of the biggest drivers, your gut. Well, today I'll show you how small intestinal bacterial overgrowth, or SIBO, could be the hidden link to your stubborn high blood pressure, and highlight a new study that proves this connection. Let's connect a classic hypertension or high blood pressure model called the Mosaic Theory to cutting-edge research on the microbiome, and then zoom into SIBO as a potential contributor to high blood pressure and what to do about it. But before we do, allow me to introduce myself. I'm Dr. Arland Hill, and for over 20 years, I've been helping first-time and recurrent SIBO sufferers restore their gut function by targeting all three phases of the condition to resolve symptoms in a timely manner. Over the past 30 years, the number of people with hypertension has doubled. Almost half of the U.S. population is dealing with high blood pressure. What's the big deal about that? Well, it increases the risk for stroke, heart failure, atherosclerosis, so hardening of your arteries, renal failure, and even dementia, which those last two, those are getting a lot worse in our society too. And frankly, many are unaware that they're dealing with high blood pressure, and it's pretty poorly diagnosed as a whole compared to some other conditions out there. High blood pressure can be broken down into two different categories, simply just differentiated as primary versus secondary high blood pressure. This is an interesting difference if you're not familiar with this, because primary high blood pressure, primary hypertension, accounts for about 85 to 95% of the cases of high blood pressure out there, but it's because of an unknown cause. Think about that. 85 to 95% of the individuals with high blood pressure don't have a definitive cause for what is actually driving their blood pressure. Secondary hypertension means that you have an identifiable underlying cause that you know what to target. So this creates a problem because patients are often left confused about, well, how do I deal with my hypertension if I don't know what a definitive cause is? And patients often are given treatment without any type of evaluation to really dig into those causes. It's more of a, you have high blood pressure, let's target it with a blood pressure lowering medication. But this truly flies in the face of how, at its most core levels, high blood pressure has been studied, because high blood pressure is acknowledged to be what we would consider a multifactorial scenario, a multifactorial model, if you will. And this was evidenced by a gentleman named Dr. Irvine Page back in the 1940s that brought forward something called the Mosaic Theory of high blood pressure. In the original theory that was brought forward, it targeted some of the combining causes, or some of these could be individual, these could be combined, so they may act in isolation, they may act at the same time to exacerbate the blood pressure. But things such as kidney function, which can affect the volume and the cardiac output, how efficiently your heart is working, the vasculature of the body, your blood vasculature, how much elasticity does it have, what's the reactivity of that particular tissue, and even the central nervous system back in the 1940s and how reactive it can be. Those were all looked at as factors associated with high blood pressure. Now, there were others that came into play, but those were the predominant ones. This is different, however, in 2025. So fast forward all these years later, and you're basically 85 years later, and now we will acknowledge that there have been some modern revisions to the Mosaic Theory based on new data that has come forward over that time frame. And now you start to see a much different picture. You see a focus on the microbiome as one of the factors, what's often called a node. These nodes are just simply the factors that could be contributors to hypertension, to high blood pressure. And again, you still see things like the kidneys playing a role here, the vasculature of the body, that's still relevant, the neural system, but we also now equally acknowledge that the hormonal system and the immune system, these all play a role when it comes to high blood pressure. And the way to just step back for a moment and think about that is that if there is not some step forward taken to evaluate each of these potential players in blood pressure, then the probability that you're going to truly be able to dig in and understand what the cause is for you, and more importantly, how to deal with that rather than just taking a shotgun empirical approach, that's probably not going to happen. Let me focus on the microbiome, right? Because I wanted to make the connection between SIBO and hypertension for you in this video. And we need to focus on the microbiome for a minute. And to do that, we need to acknowledge that dysbiosis, which is just the imbalance of the microbiota in the gut, dysbiosis can elevate blood pressure. You may be asking yourself, well, how does it do that? And it does it through exacerbating systemic inflammation. This is what many might colloquially know as the leaky gut. That's the general term that's applied to that. But the concern around a leaky gut, if you will, which is also more technically stated as intestinal hyperpermeability, the problem is that it opens the door for exposure to contents that should normally stay in the gut, at least in low concentrations, having access to systemic circulation, but now they have elevated access. They start to increase in the concentration. So one of these that plays out is something that's often abbreviated LPS. This stands for lipopolysaccharide, but it is a trigger for the immune system. It kicks the immune system in gear and it initiates a cascading inflammatory effect. And so these structural changes, this enhanced permeability in the gut, that kicks the door open for these microbial byproducts like the lipopolysaccharides. You can get hormones, you can get immune system cells that begin to have effects here. And these are all going to have downstream impact on both the peripheral and the central blood pressure control mechanisms. And what I just said there, if you just step back and think about that, may also be a new concept for you, is that you have different control mechanisms for what's happening out in the periphery of the body, out in the smaller vessels, versus what is happening in the core of the body to affect what we would think about as your central blood pressure. The other problem with dysbiosis in this conversation is that it's going to alter something called short-chain fatty acids. Short-chain fatty acids are now termed as a postbiotic. You may have heard the terminology of prebiotic, probiotic, but there's also now what are considered postbiotics, and postbiotics are byproducts of the microbes, of the beneficial microbes in the GI tract that lend downstream benefit to you as the host of those microorganisms. In the case of the short-chain fatty acids, one known as butyrate is often focused on here. Butyrate has the ability to modulate the autonomic nervous system. Well, remember, the nervous system is one of the nodes in that Mosaic theory that can ultimately impact blood pressure. And I can share with you through clinical experience that many times I have identified in working with patients that have hypertension that one of the driving factors in their hypertension is that they have a chronic neuroexcitatory response. They're in more of an excitatory or sympathetic state. There's different ways of saying that, but they tend to linger in that sympathetic state, and as a result of that, their blood pressure tends to stay elevated. You'll often see this as the systolic blood pressure tends to elevate more so than what you might see with the diastolic at the same time. So there seems to be more impact on the systolic blood pressure, maybe is the better way of saying that. But the point is that it's sympathetic activation. Well, no doubt you've probably heard of the gut-brain axis. This is, of all the axes in the body related to the gut, this unquestionably is the most popular and the most talked about. It's just one of many axes, but it is talked about often for good reasons. And when you look at the impact on that gut-brain axis, that also means that the impact that you have on the brain through the gut is now giving feedback into those other axes that may not be ideal for the feedback to them either. So now if you begin to think about things like the gut-kidney axis and how the kidney function directly affects hypertension, now you can begin to see that when you're beginning to alter blood flow, you're beginning to increase high blood pressure in the kidneys. These are all going to be messengers. There's going to be signals going between the gut and the brain, between the kidneys and the brain. All this starts to flow amongst itself, and these systemic negative cycles begin to exacerbate. And this is how a simple single node or a single causative factor for blood pressure can begin to spiral into multiple other causes of blood pressure that are all having a combining effect at the same time. You sort of sticking with this thought of dysbiosis here. You'll also have recognized, no doubt, the term lactobacillus. Lactobacillus and bifidobacterium are the two most common grouping of species that you'll find talked about in regards to the microbiota in the gut. You'll see probiotics. These are the two most common categories of species that you see in probiotics. They're just two species of many that exist in the GI tract. But for our conversation today, these lactobacillus, they also produce peptides that have modulating effects on blood pressure as well, because they can modulate something called ACE, angiotensin converting enzyme. In addition to that, you'll find that there's conditioning effects. So what does that mean? Well, conditioning effects are things that modulate directly how the microbiota function, and they can do that in a health promoting direction, or they can do it in a health damaging direction. So for example, when you look at things like diet and drugs, just as an example to really tie some things together here, a sodium-potassium imbalance. A lot of times we hear so much emphasis placed on sodium as it relates to blood pressure, but it's truly the balance between sodium and potassium that we're interested in. A diet that is higher in sodium and doesn't have consistent intake of potassium-containing foods, that is going to create that sodium-potassium imbalance. That becomes a conditioning effect in the wrong direction, and now it can begin to exacerbate and become one of those factors that pushes hypertension. You'll also see from the dietary standpoint that a lack of fiber has been associated with hypertension. And that makes sense because the fiber becomes a source of these short-chain fatty acids that I spoke to earlier. And now, just thinking through just what I've shared with you as it relates to just dysbiosis as one of these nodes in this much bigger mosaic theory that I've been sharing with you here, now you begin to see where you really have to know what's going on in your GI tract if you want to have a realistic expectation of being able to manage your blood pressure in an effective manner. Recall, however, that I said I want to take this conversation of dysbiosis as this bigger, larger term, and I want to pull it down. I want to bring it down to a more specific conversation around SIBO. SIBO is a specific form of dysbiosis. It's small intestinal bacterial overgrowth. It's, in short, an excessive load of bacteria in the small intestine. It is the most common form of dysbiosis because so many facets of our modern day life, our habits, our activities, have the potential to set us up for SIBO. The question is there any credible evidence to suggest that this may be more than just an associational connection? Well, again, recall I did lay out some mechanisms. I just laid out those mechanisms for you of how the SIBO can exacerbate a systemic process, a systemic inflammatory process. But what does the data say on this? So there's a recent study that I came across that was really eye-opening to me on this topic. And what it showed was that SIBO positive individuals were more likely to have hypertension with versus non-hypertension. So SIBO was more common in the hypertensive patient versus the normotensive patient. The patient has normal blood pressure. That group of individuals as a whole had less SIBO than the individuals in the group that were labeled as high blood pressure. Okay, so that was the first thing that was noted on this. And that's important because that right there begins to say, okay, well, we're probably starting to see the impact that the dysbiosis is having in relating to the blood pressure. The prevalence of hypertension, so this is looking at it the other way, the prevalence of hypertension was higher in SIBO positive versus SIBO negative individuals. And so basically same outcome that you're drawing the same outcome there, but you're saying that from two different viewpoints, if you will. The more important aspect of this is that what does this mean clinically? What does this mean to you, right? You're dealing with high blood pressure. You want to reduce those risks associated with stroke, with heart failure, with atherosclerosis, with dementia. Like nobody wants to be staring these conditions in the face in their middle age, certainly, or in their later years of life. SIBO, if you think about this, if we think about SIBO as an underlying driver here, SIBO is a modifiable factor. It is a modifiable node within that Mosaic model, within that Mosaic theory, and it's worth assessing if blood pressure, especially if your blood pressure is stubborn and you haven't been able to make headway with it, and you layer on top of that, you're dealing with bloating, distension, you've got food reactions that you just cannot seem to pin down. That's your body's indication to tell you. Those are the red flags saying you need to be aware of this connection. You need to follow up here and acknowledge that something is amiss, and this could be one of the driving factors. SIBO is closely related to hypertension, which can be one of the diagnostic markers, if you will, when it comes to hypertension. And a practical path in how to deal with this, let me back up before I even get into the practical path for a minute. And I want to back up because when I say it can be a diagnostic marker, if you will, it's because we do know that this correlation exists. We do know that the mechanisms behind it, those exist as well. And also because when it comes to any chronic symptom or ailment, the GI tract is going to be a player in that in almost every scenario without exception. And that's a pretty universal statement. And I don't want that to come across as a hyperbolic statement or just being hyperbole. It's not meant to be, simply because there is evidence to support that strong of a connection from your gastrointestinal tract. Now let's go back to that practical path that you should be thinking about for a moment. One of the things that you need to do is just simply confirm your symptoms. Just acknowledge, yes, my blood pressure has been elevated for a period of time. Yes, I do have gastrointestinal dysfunction that maybe I've been blowing off. I haven't been putting as much attention towards. I haven't been giving it the importance that I really should be, especially now after you've listened to this. From there, you want to consider testing. And I say consider here because you may need testing, you may not need testing. Everybody's situation can be a little bit different. Your scenario can be a little bit different here. And just to do a breath test for the sake of doing a breath test, that's not really something I would advocate for. But there are other testing options out there that you should be thinking about and exploring. Now, the next step beyond that is extremely important, especially if you don't want to end back up in this situation. And that is that you need to address your motility. You need to address your digestive secretions, and you need to acknowledge your diet. So just to give you a quick rundown here, you need to make sure that from the time you consume food until that food reaches your large intestine and until you have a bowel movement, that there is an optimal amount of time that the food is staying in the GI tract. You don't want it staying in your GI tract for too long a period of time. When it comes to digestive secretions, you need adequate acid production, adequate hydrochloric acid production. You need to make sure you have sufficient release and secretion of your pancreatic enzymes, and you need optimal bile production from the biliary tree through the liver and the gallbladder complex. And from a dietary standpoint, you need to make sure that your dietary pattern in terms of when you're eating, not just what you're eating, is also dialed in as well. If you're looking for more specifics on each one of those, check out the other videos that I've shot. That'll give you much more detail on each one of those and how to follow up on it. But you have to be able to rebuild your microbial balance if you want to continue to try to optimize your blood pressure. And let me also say this, I think this is important, and this is the disclaimer, is if you are on a blood pressure medication, do not stop. Never immediately change your current approach. You need to build some resilience, as I would tend to term it, in your body. You need to build some stability, and you need to work with your prescriber if you're on those medications to be able to monitor that blood pressure, and you need to be doing that yourself. But you need to monitor your blood pressure and ultimately work with that prescriber to get you off of that medication if that is something that is even feasible for you, or if that's something that you desire. Now, if you're listening to this and you're thinking, man, this sounds like exactly me. I see the connections between my gut. I know I have high blood pressure. Well, that's why I created a program called the SIBO Solution. It's designed to walk you through step by step on overcoming SIBO, so you're not just chasing symptoms like is too often the scenario. I'll drop a link down below if you want to do that. Now, keep in mind, here's what we're going to go. Here's where we went today. You've got this Mosaic background, this Mosaic Theory, right? So there's multiple factors associated with hypertension. We know the mechanisms. We can understand the mechanisms that are linked here. SIBO is highly, highly correlated, and there is a definitive route to deal with the SIBO if you take a logical stepwise approach and think just beyond dealing with the overgrowth. You can't just deal with the overgrowth. You've got to fix some of the other things that I mentioned in that practical path towards a long-term resolution. And you might be wondering, if SIBO really plays a role in blood pressure, then what about diet? Well, here's the problem. Most people are making the same mistake with the so-called SIBO diet, and it keeps getting them stuck. So if you're trying to apply the SIBO diet and you're looking at, oh, that's my strategy for dealing with SIBO, and using some antimicrobials or an antibiotic in there at the same time, and hopefully that'll deal with this secondary problem that I'm having, like hypertension in this case, yeah, you're probably going to stay stuck. And in fact, it has everything to do with the FODMAPs, right? That's the most common diet that's talked about here. And that's what I'm going to cover in this next video. The number one SIBO diet mistake to avoid. If you'll click here, I'll walk you right through it.